folks that might be inappropriate. You look good together, you seem happy together, is really an important thing to hear back. But I think this really rests in the individual's understanding of what is important in a long-term relationship, what is necessary, and does that person agree? If they don't agree, then that could be a problem.
And Dr. Tatkin, you mention deficits in your audio program, Your Brain on Love, and this is really important because we all have deficits in one area or another. Specifically relating to theory of mind, I've found this a frustration because, and I know generally, in general terms, women tend to be more inclined to research relationships and whatnot. But, I mean, if I was dating someone with very low theory of mind, I'm not going to probably be able to convince him to listen to your program.
Well, let me explain first what theory of mind is. Theory of mind has to do with one's ability to be curious about one's own mind. I'm curious about my mind. It starts in childhood, and then that curiosity in my mind also translates into curiosity in your mind. So I think about myself. I can imagine what it would be like to be another person. I can put myself in your shoes. I would be able to write a diary about myself. People who lack a theory of mind, either because of a brain problem or because of poor development, because their parents didn't really have it, can't do those things. They have a hard time with it. And so that would be certainly something to rule out if you wanted to have someone down the line who could see you and understand you. People with poor theory of mind are fully functional. They can be very successful in their work. It's in love it causes a problem. Very nice people, by the way, can be. It has nothing to do with that, but it does have to do with insight and curiosity and imagination. So, yeah, that could be a showstopper right there if you find that that's a problem.
And Dr. Tatkin, also, I'm curious, because you mentioned a number of deficits. There's empathy. Some people have less empathy. For me, I'm huge empathy. I have, I guess, what you'd call thin boundaries.
Boundaries, okay.
I feel deeply. I'm deeply impacted.
Do you get what other people get? Do you have what's called affect contagion?
I do if I'm not really mindful of taking care of myself. It's something that I'm working on. I mean, some of these things you can learn and develop, and other things you may have a blockage in your brain. It really depends, right?
Right.
And with regards to theory of mind or any of these deficits, I'm curious, is this a spectrum, or do you have it or you don't?
Well, it's not really known for sure. This is a hard thing to pin down. The reason we're even thinking or talking about deficits is not to put anybody down. It's the idea that, our abilities to do certain things are not even in terms of brain power. We know this in terms of, learning deficits. Or I'm not very good at math. My wife is terrific, and so I'll never be very good at math. But what about socially, emotionally? How good am I at reading a face? How good am I at responding to an internal feeling? Or do I even know it's there? How good am I at thinking quick and resolving an issue and calming someone down? These are skills and abilities that can make the difference in a relationship when things get difficult. So we're talking about from big to small, small being I'm not so good at reading emotions, to I can't read them at all. And there are people who can't read faces. There are people who have something called prosopagnosia, and they can't remember a face. There are people who can't read their internal sensations or feelings. So in other corners of their life, it doesn't really make a difference. But in love, it starts to make a big difference. In fact, love is probably the most resource-demanding thing we ever do, much more than work. And so if we have some of these so-called deficits, things that we're not that good at, they're going to come up there in the relationship, and they're going to be misinterpreted by our partners as being purposeful. You're doing that purposely. You really could do that. You just don't want to do that. And sometimes we find there are people who actually can't. I mean, they don't get it. It's not they're not doing it purposely. They never could do this, and but understandably, it's being misinterpreted.
And Dr. Stan, I've talked about the work of Alison Armstrong on this show before, and she talks about the difference between men and women, and some things are, in general, somewhat gender specific, like men tend to be more of this way and women tend to be more this way. But this isn't, these deficits can come up in men or women, and
they can come up men or women, but men, generally speaking, are not, and this is very general, are not as good as women because of the wiring in the brain, not as good at dealing with internal feelings and understanding them and being able to communicate with those feelings. It's not a strong suit generally of men. It is more of a strong suit with regard to women. And so there are some gender differences in terms of how we're built and how our wiring is. But then there are some things that are not really gender-specific, but we assume they are, like the island and the wave thing. There are plenty of island women out there, but we generally think of islands as being men, and that's not really true. So it's easy to get all this stuff confused. But yes, there are plenty of women out there who can have, and that would make sense, would have certain deficits that would disable them from being empathic or them to be able to see a certain emotion on a face or something like that.